prostate cancer screening continues to be a relatively hot topic. One of the things that we look at as urologists is that if we can find a man who is at risk for prostate cancer, and if we find that man when he's younger and find that cancer, again, when it's in its infancy, we want to find that prostate cancer early, we can cure a majority of those patients. We don't want to find prostate cancer too late. On the flip side, we also don't want to be doing PSAs and screenings and rectal exams on every man that walks through the door. So, debatable in terms of really the exact timing on here, but here's what I tell my patients, and I think this is defended with very good data. For men with a family history of prostate cancer, I like to get them into the office at somewhere around the age of 40. It is rare that we see those patients with prostate cancer, but somewhere around the age of 40. And what I want, we'll do a quick rectal exam. And second thing is we're going to get a PSA. And we're going to get a PSA on those guys, not because we're going to start doing PSAs every year until they're 75 or 80 years old. We're going to get a PSA because I want to get that baseline. If I can get a baseline PSA on a man in his 40s and it's below 0.6, that's a man that I can delay his repeat PSA for at least another 3 or 4 and potentially even 5 years. So I can see him back in the office in 3 or 4 years and again, repeat another one and again, a physical exam. However, if this is a man who actually has a PSA of 1.1, 1.2, or again, above 0.6, this is a guy who I'm going to be wanting to follow closely. It goes back to this original point. Can I find men with prostate cancer early? These are the men's lives that we're saving, not necessarily the guys that, are 75 years old and we're just finding a PSA of 2.6 and we're barely finding these low-grade cancers. It's these younger men. So, bottom line, at the age of 40 with a significant family history, if you don't have a significant family history, I still think it's a good idea either at the age of 45 or 50 to get a physical exam and a baseline PSA. If your PSA is low, and the definition of low is really less than or equal to 0.6, we know that the chance of something devastating or developing that prostate cancer in the next 10 to 15 years is actually going to be very low. So make sure you get tested, know what your numbers mean, and then go forward and the appropriate times. You don't have to visit the urologist at 40 and think he's going to be your best friend coming in every year.
Some prostate cancers are high risk, aggressive, and more likely to spread. Others are low risk, least likely to have bad outcomes. The biopsy says cancer, but current diagnostic tools provide limited information about how aggressive a man's individual disease is. So most men decide to treat prostate cancer immediately. Once treated, many men experience serious long-term side effects, like incontinence and sexual impotence. Immediate treatment isn't always needed. But right now, a man can't be sure if his cancer is the kind that is likely to require treatment or if he's okay to wait for now. What if there was a test that could determine how aggressive prostate cancer is? Genomic Health is developing a new test to do just that. By reviewing the underlying biology of the tumor and using genes from multiple biologic pathways, the test can predict the aggressiveness of prostate cancer when diagnosed, allowing a man to make a more informed treatment decision with confidence, taking care of himself with more information and greater peace of mind.